Good evening. This is Dr. John Bennett broadcasting from Miami. We have another in the series of Parkinsonism hangout educational videos with Dr. Abdul Rana. He's a world-renowned Parkinsonism educator. And he's here tonight to talk about the autonomic system in Parkinsonism. Good evening, Dr. Rana.
Good evening, Dr. Bennett. How are you this evening?
Very good. I'm glad it's not slowing down here. Okay, I'll start off with a question. This is a relatively short video. How is the autonomic nervous system involved in Parkinsonism generally?
The involvement of autonomic nervous system in Parkinson's, it starts becoming more obvious as the disease progresses. In the beginning of onset of disease, the involvement of autonomic nervous system may not be obvious, although it may start in the preclinical stages. The autonomic nervous system is very vulnerable to alpha-synuclein pathology in Parkinson's. The cardiac sympathetic denervation in alpha-synuclein pathology, it could start in the pre-symptomatic phase of Parkinson's, and as disease progresses, it may become more worse. The cardiac sympathetic denervation is not only specific for Parkinson's, it could occur in other neurodegenerative conditions, such as multiple system atrophy. Barak and his colleagues, they proposed a pathological staging of Parkinson's disease, and they suggested that the initial pathological changes, they start in the lower brainstem, and then they progress forward. The cardiac sympathetic denervation, it may start before the alpha-synuclein deposition at the other sites. Although the involvement of the peripheral nervous system was not emphasized in Brock's model of pathological staging of Parkinson's disease, but the Lewy body pathology does involve the central autonomic nuclei in the caudal brainstem in the early stages, and it is becoming more clear that the peripheral nervous system is affected early in the course of disease in patients with Parkinson's. Those patients who develop orthostatic hypotension early in the course of disease, or relatively early in the course of disease, they may have more pronounced autonomic dysfunction as compared to those who develop the postural hypotension in the later part of the disease.
Very good. What can it lead to, this is dysfunction in the autonomic nervous system?
The autonomic nervous system dysfunction could lead to many disabling symptoms, and some of these symptoms may be very difficult to treat. So autonomic dysfunction could cause urinary bladder problems, which can lead to urgency of urination, more frequency of urination, nocturia, and sometimes sphincter and the wall of the bladder, dyssynergia, incoordination. In some patients, it could cause postural hypotension as well. Constipation is also a consequence of autonomic dysfunction. And another important symptom of autonomic dysfunction is sexual dysfunction. Some experts believe that the dry skin also has some involvement of autonomic nervous system. And in a small number of patients, there could be problems such as cold sensitivity or episodic sweating. This could be related to autonomic dysfunction in Parkinson's disease.
Okay, that quickly sums it up for the generally how is the autonomic nervous system involved in Parkinsonism. Any last thoughts before we close this?
The autonomic nervous system dysfunction, as I was just saying, it could cause symptoms which could be quite disabling, such as postural hypotension, urinary dysfunction, and sexual dysfunction. These symptoms are such that they are difficult to treat. They are found in most of patients with Parkinson's disease, and they do get worse as the disease progresses. And it could be a challenge to manage these symptoms.
Very good. Okay, thank you, Dr. Rana. We're on to the next in the series of Parkinsonism videos. Thank you very much.
Thank you.